This video is going to be an overview of the arms and trunk bones. Starting with the clavicle, we have the acromial end, called because it attaches to the acromion process on the scapula, and the sternal end, called because it attaches to your sternum. And then this bump here is called the conoid process. The scapular bone I get a lot of questions on, so I emailed you all and I'm going to put in the discussion board a separate video just going into detail and on tips and tricks on just the scapula bone. Here is just a short list of some of the terms you'll need to know. The spine of the scapula on the back here, glenoid fossa or cavity, either one's correct. The structure here where the head of the humerus attaches to form your shoulder. The axillary border, which is always on the same side of the glenoid fossa. The vertebral border, which is always facing the vertebrae, so it's on the opposite side of the glenoid fossa. The acromion process, this here, where the acromial end of your sternum attaches, or excuse me, your clavicle attaches. The infraspinous fossa, so we talked about this is the spine of the scapula. Below this area is called the infraspinous fossa. Above this spine, you can see here is the supraspinous fossa. And be careful not to get that confused with the subscapular fossa, which is different. It's on this view here only, not on the side with the spine. Just this whole section here is the subscapular fossa. And lastly, just this little structure here is called the coracoid process. There's a few other terms on the scapula, but this isn't a comprehensive video, so those can be found in your atlas or your lab manual. The humerus bone, we can start off, this is the head here, where the natural end of the head, you can see this line here, that's considered the anatomical neck. For surgical purposes, this is called the surgical neck down here, further below. The greater and lesser tubercle and the intertubercular groove all go together. They can be seen right here. This groove right here is the intertubercular groove. This bigger tubercle is called the greater tubercle, and this is the lesser tubercle. The trochlea is this little section down here, just this like funky shape right there. The capitulum is this round marble shape right next to it. You cannot see that in the posterior view, only on the anterior view. The coronoid fossa is on the front here. It's where the coronoid process of the ulna fits in your elbow joint. So that's the coronoid fossa. The olecranon fossa, which can only be seen in the posterior view, is here. It's the back of your elbow where your olecranon process of the ulna fits into that little space right there. The radial fossa is again on the anterior view. It's just next to the coronoid fossa. It's right here where your radius fits in on your elbow joint. The medial epicondyle, which you can actually feel in your elbow, it's that huge bump on the inside right here. It's much more pronounced than the lateral epicondyle is. So if you're trying to distinguish between whether it's a left or right humerus, you can look at the medial epicondyle and we can know that this is a right humerus. The ulna we talked a little bit about, so I'll just show you a picture of it now. The trochlear notch is where this trochlea fits in exactly. It's pretty cool to see actually. The trochlea fits just snugly right inside this trochlear notch. The coronoid process is this small process right here. The olecranon process here. The styloid process is down at the head of the ulna. It's this little pointed part right there. That's called the styloid process, similar to the one on the skull, named because it's kind of pointy like a stylus. The radial notch is this right here, and not pictured on the other side of the ulna is the ulnar tuberosity. The radius, this is the head here, the radial head. The styloid process is down at this end, so notice the difference between how the styloid process and the head are on the same side on the ulna, whereas on the radius, the styloid process is right here, and the head is at the other end. And then we have the radial tuberosity, this big tuberosity here, and the ulnar notch, which is down, it's not directly pictured, but it would be right here, right where your ulna, the head of the ulna comes to right here and fits right into that notch on the radius. So carpals, metacarpals, and phalanges. For carpals, there's lots of mnemonics out there. This is just one I found on the internet that I liked. Straight line to pinky, here comes the thumb. So if you start at the scaphoid, you say straight line to, and then on the other side is the pisiform. You can't see it in this picture, but straight line to pinky. Here comes the thumb, and you should end on the thumb when you do this mnemonic. So here comes the pinky, or excuse me, straight line to pinky, here comes the thumb. So straight scaphoid, this is the scaphoid bone here. I remember it by, this is the most common bone in the wrist that breaks when people fall and break their wrist. The lunate, it doesn't quite appear so in this picture, but in your atlas pictures, there are like little craters in this bone, makes it look like the moon. So luna, lunate, that's how I remember that one. And then next to it is the triquetrum, and then on the back side of the triquetrum is this little marble-shaped pisiform. It's a very small bone in your wrist. Hamate, I remember by hook of the hamate. So you can't see it in the the posterior view, but in the anterior view, you can see this little structure here. It's kind of a hook. It comes out from the bone and is a hook. So we call that the hook of the hamate. And that's how I remember that one. Capitate is just the largest one right here in the middle finger. Right there. The trapezoid right here on your pointer finger, at the end of your pointer finger. And then the trapezium attaches directly to the thumb. I remember this by, you can't do trapeze without your thumbs. If mnemonics work for you, if you just want to remember maybe which finger it attaches to, or you're good with just straight up memorizing, whatever works for you, just get these straight in your mind because these can be hard to remember. They're easy to forget. So, and then we went over carpals, but these here circled are the metacarpals. So metacarpals, you only have to number. These are not named. And the numbering starts always on the thumb. So the thumb metacarpal is the first metacarpal, second metacarpal, third metacarpal, fourth, and fifth. In your lab manual, and I think in the atlas as well, it says metacarpal 1, 2, 3, 4, 5. You can either say first metacarpal or metacarpal 1. Doesn't matter, we'll give you credit for both of those. Next are the phalanges. So these here are the phalanges or the digits. Each individual bone, right here, like from this knuckle to this, from this knuckle to this knuckle are just a phalanx. So first we'll start with the proximal phalanx. These are the ones that are closest to the wrist. So most proximal, goodness, I keep doing that. So proximal phalanx right here. And you number those just the same as you would with the metacarpals. So first, second, third, fourth, fifth. And then next we have the proximal, medial, and distal, medial phalanx or middle phalanx right here. 1, 2, 3, 4. You don't have one in your thumb because it's shorter. And then the distal phalanx, just these here. 1, 2, 3, 4, 5. Just the tips of your fingers are those distal phalanx. Careful not to get confused between the individual bone phalanx and this whole thing here. That's considered a digit or a phalange. Okay, ribs. So this is the head of the rib, this is the neck of the rib, the tubercle of the rib, the angle of the rib, costal groove here, and then this whole section is just the body of the rib. This is just costal cartilage. It doesn't show it like this in your atlas. You can only see the costal cartilage in this picture, which is these like lighter white sections here. So you have 7 pairs of true ribs starting from this first one here, down 7, and then you have 3 pairs of false ribs. That just means that they attach with cartilage over here. They don't attach directly up here. And then you have 2 pairs of floating ribs, which don't attach anywhere. They just hang in the back there. And let's see, I think that's all. And sacrum, we have the anterior view here. So these holes, each of them, they don't have individual names, but they're all considered anterior sacral foramen. Then you have the auricular surface. That's where your pelvis attaches, the joint where your coxal bones attach. And then the median sacral crest. A lot of times we'll get middle sacral crest or just sacral crest. Remember, it's median sacral crest here. It's these bumps here. It's kind of looks like the back of a dinosaur, kind of. So, and then this is the posterior view. And these holes here are called posterior sacral foramen. And then it's not directly visible, but starting here and ending here, there's like a hole going through this canal all the way. That's called the sacral canal. Hope that was helpful. Happy studying.